fertility preservation falls into two categories. So for some, it's a process that is an option due to cancer perhaps. So a lot of chemotherapy options can cause harm to reproductive organs. The other option is for patients that want to potentially delay starting their family and can be used for family planning purposes. Egg freezing is the process of stimulating the ovaries to create multiple follicles which contain eggs. We then retrieve those eggs and cryopreserve them so they can be thawed and fertilized and used in the future. So this is a common practice, and the technology has improved greatly over the years. So our success rate with egg thaws is much higher than it was 10 or 15 years ago. Sperm freezing is the process of collecting a sperm sample in a cup and cryopreserving it. It's much more straightforward than going through the egg freeze process. And similarly, it's used often as a fertility preservation measure for men that are affected with cancer and will require chemotherapy. Embryo freezing is the process of stimulating the ovaries to produce multiple follicles which contain eggs. We then retrieve those eggs and fertilize them in the lab. This will create embryos, and we watch these embryos over a period of days, and we choose the viable embryos and freeze them. We cryopreserve them for later use. The expected result with the process of egg freezing and embryo freezing really depends on a woman's ovarian reserve. So before we start this process, we do testing so that we can give the patient and the couple an idea of what to expect as far as egg number or embryo number. Frozen eggs and embryos can be stored indefinitely in the IVF lab. A lot of couples are worried about the safety of their frozen eggs and embryos in the IVF lab, but we have many backups to ensure that they're kept safe.